So the murmur of mitral regurgitation will be heard in systole. So it will produce a pansystolic murmur. And the murmur of mitral regurgitation usually travel to the axilla. So tricuspid stenosis or tricuspid regurgitation, uh, the most common cause of tricuspid regurgitation or tricuspid stenosis, they can be caused by rheumatic fever, as well as they can occur in IV drug users due to infective endocarditis. Remember that left heart murmurs are best heard during expiration and right heart murmurs are best during inspiration. Because during inspiration, there is an increased blood flow to the right side of the heart. So the right-sided heart murmurs, such as the murmur of pulmonary area and tricuspid area, because they are a part of right-sided heart and blood flow to the right side of the heart is increased during inspiration. And left-sided heart murmurs, such as murmur of mitral and aortic valve, will be heard best during expiration, because during expiration there's an increased blood flow to the left side of the heart, because during expiration the blood flows to the left side of the heart from the lungs. So that's why there's another basic principle that you need to remember, that right-sided heart murmurs are best heard in inspiration and left-sided are best heard during expiration. Chest X-ray in mitral stenosis we have already discussed. On chest X-ray, there will be straightening of the left heart border in case of mitral stenosis. And ECG may shows P mitral because of uh, left atrial enlargement, and there will be bifid P wave. And also ECG can show features of atrial fibrillation in case of mitral stenosis. Echocardiography will show thickening of mitral valve leaflets due to thickening stenosis of the mitral valve occurs. Aortic stenosis, the commonest valvular disease in elderly patients over 65 years of age. Usually aortic stenosis is asymptomatic apart from exercise intolerance. It can cause syncopal fainting as well because of decreased blood flow to the aorta because of the narrowing of the aortic valve. Now, normally aortic stenosis means the valve is narrow and it fails to open properly. So normally aortic valve should open during systole. So aortic stenosis will produce an ejection systolic murmur, and the aortic area is located in the right second intercostal space. And as it's a left-sided murmur, so it will be loud during expiration. And the murmur of aortic stenosis radiates to the carotid artery. So if an elderly present to you with mild exercise intolerance with ejection systolic murmur, then your diagnosis will be aortic stenosis. And to confirm our diagnosis, we'll perform an echocardiogram. And the treatment of aortic stenosis is valvular replacement.
Aortic stenosis is heard on the right side. So Isn't it should be like
Yes.
more heard during inspiration, not
Uh,
expiration?
uh, the area of auscultation is on the right side, but
Yeah.
aorta is basically located on the left heart. Aorta is
Right.
basically a part of left heart. So when I say that left-sided murmurs are best heard during expiration, I am referring to the left heart and not to the areas of auscultation.
Yeah. Okay. 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 That's fine. Yeah.
So aortic stenosis, pulmonary aortic stenosis, and mitral stenosis. The cause of mitral stenosis is rheumatic fever, and the most common cause of aortic stenosis is old age. The X-ray finding of mitral stenosis included a straight left heart border. ECG finding include bifid P wave and atrial fibrillation, and echocardiogram finding included thickening of the leaflets of mitral valve. The treatment in both cases is valvular replacement or prosthetic heart valve. And if the patient is not fit for surgery, then balloon valvoplasty can also be done. A balloon is usually used to open the stenosed valve if the patient is not fit for surgery. So this was all about heart murmurs, their diagnosis, and their causes. We'll end our session here today. Tomorrow we'll start from atrial fibrillation. Sorry, tomorrow I have a duty, so tomorrow there will be no class.